Hello, everybody, and welcome to this webinar on access to public services for people from outside the European Union. This webinar is organized by AER, the Council of Europe, and IOM in the context of the Include EU project. I'm Joanna Passevicius, coordinator for policy and knowledge transfer at the Assembly of European Regions, and I'll be the moderator for this event. This webinar is the first of a series of webinars and other activities which will facilitate exchanges and build a mutual learning community across Europe on integration policies and practices at the regional level. Indeed, regional and local authorities are at the forefront when it comes to addressing integration needs in practice. This has been very clear in the context of the COVID-19 pandemic, which has strongly tested the current systems in place. It has revealed tremendous needs, but also the resourcefulness which exists at local and regional level. So this shows how essential it is to create opportunities for structured and meaningful mutual learning on integration in order to enable regional and local authorities to share experiences and improve policies and practice. To facilitate these exchanges, we have at the moment two frameworks which are interconnected and both offer opportunities for any of you who are participating in this event today. On the one hand, AER and the Council of Europe have launched the Intercultural Regions Network, chaired by Oriol Amorós, Secretary of Equality, Migration and Citizenship for the Government of Catalonia, and he will present the network in a few minutes. The network provides support for regions to design, implement, and evaluate diversity and inclusion strategies. On the other hand, AER and IOM are cooperating in the framework of the Include EU project, which is funded by the European Union and is mapping regional practices, providing opportunities for experience exchange and social innovation, and supporting the development of a mutual learning community. By the way, the info sheet of the project is in the handouts of the webinar, so you may explore a little bit your control panel and check the handouts. You will find there also the presentations of the speakers. So you can also find information about this project via the event page. We are very honored to welcome our speakers today. So Oriol Amorós, Secretary of Equality. I'm changing my screen to see everybody. Oriol Amorós, Secretary of Equality, Migration and Citizenship for the Government of Catalonia. Hey, Oriol.
Hi, how are you?
Fine, thank you for being here. Nuria Diaz-Gardia, Policy Officer, Director General for Migration and Home Affairs, Unit C2, Legal Pathways and Integration at the European Commission. Hey, Nuria, welcome. Thank you for being here.
Thank you. Welcome.
Dominik Zenner is a Senior Migration Health Advisor at IOM at the Regional Office for the European Economic Area, the European Union and NATO. Welcome, Dominik. Thank you for being here.
Thank you.
And Irena Guidikova is the Head of Division, Inclusion and Anti-Discrimination Programs at the Council of Europe. Welcome, Irena. Thank you for being here.
Hello, really pleased to be here. Thanks for inviting.
Geertrui Lano, Senior Regional Labour, Mobility and Human Development Specialist at IOM at the Regional Office for the European Economic Area, the European Union and NATO, will facilitate the question and answers session. So you can type your questions in the question section of the control panel during the whole webinar. Anytime you have a question, just write it down in the question section, and she will collect and collate all the questions for our speakers. Please make sure, though, that you indicate in the question for whom your question is. That will be more easy. And now, let's start the webinar. Oriol Amorós, the floor is yours.
Thank you very much. I'm very honored to be here, and thank you, the organizers, the AER, to want to talk about interculturality. When we speak about migration, we have to keep in mind that premise that the idea of Europe is built upon the history of migration. As a result, today we are a profoundly diverse society. People from nearly all nationalities that speak over 300 languages and that are affiliated to over 20 confessions cohabit in Europe. Nonetheless, we haven't been able to manage this diversity properly. Most people with a migrant background have been victimized at some point, and 24% of them are being discriminated on average 5 times a year, which is not a few number. Also, worryingly, racist and xenophobic expressions are now increasing in Europe. The problem we face, however, is not only related to the perception of discrimination. Migrants are also less likely to succeed in school and are at higher risk of poverty. So we can look to different figures of social data, and we always see this kind of inequalities. The picture before us makes it clear that we need to act consistently to change this trend. The first step we should do is look at what has worked and what hasn't in the past, which brings me to the next point, please. Traditionally, there have been 2 paradigms to manage the diversity for the integration of migrants. First, the assimilation, where migrants were asked to give up their social and cultural aspects and adopt those of the hosting society, and multiculturalism that emphasized the respect for diversity, but that didn't generate a sense of belonging to the host society. Although both models had some positive aspects, they haven't achieved good enough results in building community for everyone. In this scenario is where emerged interculturalism as a new scope for inclusion policies. This paradigm, for us, bases on 3 pillars to create a cohesive society and foster the sense of belonging of everyone. First, equality and rights and duties for all people living in the country. Without this equality, we won't be able to strengthen the sense of belonging. Without equality, we cannot talk about sense of belonging. Acknowledging and valuing diversity. We are a diverse society. Europe is based on diversity. Europe itself, as a political body, is a very innovative experiment to manage diversity in their institutions. So acknowledging and valuing diversity is the second pillar. And third pillar is foster interaction among all citizens. Only by talking to each other will be overcome our difference and build up in a shared future. And we have to be aware that not all interactions happens spontaneously. So we need explicit policy to foster interactions among all citizens from different origins, different religions, different backgrounds. To promote the intercultural paradigm, we have launched the Intercultural Regions Network. This network is based on the positive experience of the intercultural cities of the Council of Europe. So I have to thank the Council of Europe for all their advising and all their help in this initial steps. Nonetheless, we believe that many regions have essential competencies for the inclusion of migrants. So now, many times on the public debate in Europe, we hear the voices from the states, sometimes from some cities, not all municipal level, but some cities has a very important and positive presence in the public sphere. But regions many times have been forgotten, and regions in many countries has the essential competences on the inclusion process. For example, education, for example, health system, for example, job inclusion, and others which are really the key competences in an integration process. Intercultural regions started unofficially about a year ago, as the Assembly of European Regions adopted the position papers towards an intercultural Europe. So the Assembly of European Regions has an official paper signed a year ago supporting the intercultural paradigm, and was formally launched in November of the last year when we adopted the principles and objectives of the network. Apart from the Council of Europe and the Assembly of European Regions, today we are 10 regions that are already members. We are committed to working towards guaranteeing the implementation of the 3 pillars I mentioned before in all policies of our regions, and towards fighting all forms of of racism and xenophobia. We are fully committed to contributing to the construction of a just society where everyone, regardless of their background, has the same rights, obligations, and opportunities, and where everyone feels that he or she is a part of this diverse society. The challenge we have ahead is massive, we know that. But we are determined to achieve it step by step. And how we will do it? We will work on different ends. First, capacity building on a specific training for public authorities, both for political figures as well for public servants. It is crucial that people working for interculturality have a proper understanding of its meaning and have the tools to establish the necessary strategies to incorporate the intercultural perspective in policy making. This training will also include peer-to-peer exchange among the member regions, the gains to learn from the successes each one has had. Second, self-assessment of public policies and establishment of intercultural plans. The network will support the regions to conduct a self-assessment on their policies, taking into account the intercultural scope. And third, advocacy policies. Since one of the aims of the network is to promote interculturality also in regions that aren't member yet, one of the aims are advocacy activities. And also we want also to have some influence for the intercultural perspective at the European level. We know that our aim can only be achieved by establishing synergies with other initiatives, institutions, and projects. Only by uniting the efforts of all key actors will be able to work towards a more cohesive community, not only in our regions, but also in Europe and the world. So you are invited to know more and to ask the questions you want to do about this network, and to make advocacy to your regional authorities for if they want to adopt this perspective with us.
Thank you very much, Oriol. Indeed, and you very well stressed the fact that it's important to collaborate also with institutions, and this is also the reason why we invited today Nuria Diaz-Cardia, who will explain to us the current legal framework and the current strategy framework at the European level. Nuria, the floor is yours. Thank you so much.
Thank you. I'm very happy to be here. I'm very happy to see this webinar and all these discussions and the initiatives like what Oriol just described. It's a pleasure to see so many good initiatives. And also I'm glad you said about synergies, because like this, I don't have to say lots of things, to repeat lots of things that you've said, with which I agree very much. So I wanted to give you today a bit the perspective from the EU. So that it fits a bit into this whole picture of working on inclusion at the local, regional, national, and EU level. I want to give you the perspective from the EU, and is that first of all that we are completely aware that integration takes place at the local level. That this is where it's the best place to make the decisions. You're close to the people. You know the needs. You know the resources. You know what you're good at. You can establish all the collaborations that need to be established for inclusion to work and to advance. And the EU has a complementary role to this. So in terms of policy and competence, the competence is limited at the EU level, because the competence goes to the national level according to the EU law. But for the EU, we have a competence to give incentives and to give support. And this is very important. I think we can do a lot giving incentives and support to foster integration. And this is what we try to do to use our competence to the full, that we can use it. We have a collaboration with the Committee of the Regions, because we see that we would like to have a way to reach to all the regions and the cities, the towns, also with different sizes, because sometimes at the EU level it's easier to have contact with some bigger cities, for example, but we know that there are smaller cities, towns, smaller places, and it's important to reach everywhere. So that's what we are associated with the Committee of the Regions, with their initiatives on integration. But what I wanted to tell you more today is some initiatives that we've done in DG Home, so where I work in the Directorate for Migration and Home Affairs, working on integration. And it's something we've done since 2016, which is the partnership under the urban agenda of the EU. And why I want to mention it, it's because it's a novel institutional way of working, because it was together working with member states, with cities, with Commission, with the civil society organizations, so multiple partners working together and developing some actions. And we tried to do some actions, and we've been learning from them. And two I wanted to highlight because they also fit very well with the spirit of what I think is the webinar we'll discuss today. One is the Urban Academy on Integration, and the other is the European Migrant Advisory Board. So the Urban Academy, it's something we launched as a pilot, and that we think is very successful. And it's basically an academy, a 2-day peer-to-peer learning, where we invite regional and municipal people working at regional and municipal level. So rather the civil servants, and to have a discussion and a peer learning event for 2 days with facilitation. And people bring their I don't want to say the problem because I don't want to put the negative in it, but they bring the issue they're concerned with and they're working with, and they bring it to their peers to discuss together and see how the others are doing it, what steps could they take. And this is something that we've piloted, and we think it's a very good initiative that we would like to continue in the future. And the other one is the European Migrant Advisory Board, which was a pilot again. And it's to set up an advisory board of people who are themselves migrants or refugees, and they have an expertise on migration, inclusion, asylum. And they are there to advise and to bring their expertise, because we hear this often actually, that while talking about migration, about inclusion, we talk about migrants, but we need to talk to them. And one way is to basically involve them and to listen to them and to support their participation. And this initiative was a pilot that had a beginning and an end. It was a test. We tested it and we thought it was very good. So we are seeking now to establish a bit in a more formal way as some sort of group to inform the Commission. So these are the two things that I wanted to highlight. And then the last one is that to summarize a bit how the EU can support the work at the regional and the local level. There are three big things we're doing. The first one is about data and analysis. So we try to support data collection at the subnational level. We try to support the analysis, the learning. The other aspect, the other pillar, if I can say, is the mutual learning. And that fits very much in what you're doing as well. We also do it at many levels. So foster also across at the national level. We really try to foster the discussions and having this, showing practices that you would like. We were discussing before with Johanna about what is the best practice. So it's more like, what practice would you like to share with the others? What practice you think can help others? Or what have you learned from this practice that you would like to share with others? So this is also the second part of the work we do. And the last part is the funding. So we'll just mention it very briefly now because my time is over, but you're welcome to ask questions afterwards in the chat and I can respond. But definitely what I said now about the importance of the local and regional level, the importance to listen to migrants and refugees themselves and to involve them, this will be reflected also in our funding priorities. So if you have questions, I'll be glad to answer. Thank you, Johanna. And thanks to all.
Thank you so much, Nuria. This was really super interesting. Also, this whole link between what Oriol was mentioning, that things don't happen spontaneously. It's not that people are bad, but things don't happen spontaneously. So we have to facilitate. We have to provide a context, a framework, opportunities, space, and so here we see the role of the EC in terms of incentives, in terms of support. Nuria, would it potentially be possible also in the chat section to share links, or otherwise if you don't have them at hand, we can share them afterwards in the follow-up email, like the link for the Urban Academy and things like that?
Yes.
I think it's quite interesting if we have the direct link to that.
Yes. I will, if I may, I will send you later, but the links. But in fact, if everybody can look at the European website for integration, there you have, we post a lot of information on if there is an urban academy, will be there. If there is funding opportunity, it will be there. So this is a good one place where you can look at European website for integration, but I will share with you the specific links so it's easier for people who are interested to find the information.
Thank you so much. So the European website for integration, don't forget, that is where you can find a lot of opportunities. Don't forget also that you can ask questions. At the moment, I don't see questions. So please do ask questions for our panelists, so that when the time for question and answers arrives, we already have a good number of questions. Now I will do a little poll. Because as you're all by default on mute, we don't really know you. It's not easy to interact with you. So we have prepared a quick poll to know about the situation in your region. So it will appear on your screen and you just have to answer the question. The question is, what is the main barrier to access to services in your region? You just choose one. So if you could do that pretty quickly now. As soon as there's a good number of answers, we will close the poll and show the results. And the poll will not show who said what. It's really more to know about trends, about priorities. So it's not to test you. It's not at all to test you, definitely not. Okay, 55% answered. If a few more could answer, that would be great. Okay, 64. You can do this. Okay, I'm going to close the poll so that we don't lose time on the agenda. Good. Now we're going. Okay, so here we can see, oh, it's actually very interesting because most answers have similar numbers, and it's lack of cultural competence that comes at the top of the top. That's really interesting. The figure is double, so yeah, very interesting. Okay, so now we're going to the next point of the agenda. Dominik Zenner from IOM will make a presentation on why health matters, and especially will share the experience from the COVID-19 crisis. Dominik,
thank you very much, Joanna. I start talking until I get the rights to share my screens. Oh, yeah. So let's see whether I can show my screen. I hope that's visible. So I'm going to access. Okay, fine. So I'm going to talk about access to health, and I'm very grateful for being part of this session. Thank you very much for the invitation. Health is actually an integral part of integration and, of course, of intercultural and of inclusion. And it's now very apt, of course, in the COVID crisis to talk about this. So I will give you an overview, and will, of course, some of the ideas and notions will overlap with some of the previous speakers, and you'll see, but it'll be a very health specific thing. I don't have any conflict of interest, so I might go just through that. So here's my outline. I'm going to talk about migrant health and migrants just as a warm-up, then about migrant health and access to care, why it matters in COVID, and give some conclusions. So who's a migrant? Just as a warm-up, basically, you know, or probably the IOM definition of a migrant as any person who's moving or has moved across international borders or within a state, regardless of the legal status, whether the movement is voluntary or involuntary, what the causes for the movement are, and what the length of the stay is. This is quite well known, and here's some typologies, for example, the lawyer in the City of London or the student, but also people that are experiencing forced migration. And of course, in the EU, part of the setup is that we're talking very often about third country nationals with respect to people that are not within the domestic or legal framework of the EU. So what are the determinants of migrant health? Just very quickly, of course, there are individual factors that we all know, biological factors, there are lifestyle factors such as the eating or smoking or things like that. But then we come to what I think personally the really interesting part, and remember this, these are living and working conditions and social and community factors, all of which impact on the health of individuals. And this, of course, is different in because migration is not a static process, is different in the different phases. So the pre-migration phase, the movement phase, the arrival and integration phase, and the return phase all have different impacts on either promoting health or sometimes promoting illness in those factors. And so some of the vulnerabilities, or many of the vulnerabilities, arise from that concept, and that's quite important to keep in mind. What do we know about morbidity and mortality amongst migrants? Well, surprisingly little. This is taken from a systematic review a couple of years ago, which shows you that basically this is 96 studies from 92 countries, so relatively representative, except there was an underrepresentation of lower and middle income countries and lesser from refugees and asylum seekers. But the mortality, the death rate, was overall lower than for natives, but it was there were particular items which caused a higher mortality. So when you think of the well-known healthy migrant effect, that's true to some extent, but as you can see here, in infectious diseases, particularly, and external causes, that's accidents and things like that, this was higher. But the bidirectional relationship between migration and health remains poorly understood. But certainly it's impacted by access to healthcare as well. So let's talk about healthcare coverage. Universal health coverage, you may know, is a part of several SDGs, particularly the health one, which is 3.8, which is access to quality essential healthcare services, and of course quality and affordable essential medicines and vaccines for everybody, dependent not dependent on typology of socioeconomic status or whatever. And then there are the migration ones, the 10.3 and the 10.7, all of which promoting, of course, universal access to healthcare, which is of course a flagship policy of WHO as well. What do we mean by universal health coverage? This is important to give you the dimensions. So there is, so the dimensions are the extent of inclusion in statutory health systems coverage, but also the basket of service covered and the extent of out-of-pocket payments. And this, of course, and I'm coming and in line with previous speakers, of course, when you talk about access to healthcare, you're not only talking about eligibility, but you're talking about true access, about the availability, about the accessibility, the acceptability, and the quality. It needs to be culturally appropriate. It needs to be accessible to people in different circumstances. We measured this a few years back. It's called the Migration Policy Index, or the MIPEX, which was a health strand in 38 countries. The publication is there. And what we found is that member states have extremely variable inclusion of migrants. There is no gold standard, actually. It could be improved in virtually every member state. But the inclusion varies not only by the member state itself, but also by the typology, with those that are on the more vulnerable end, such as, for example, people that have no legal status, being having the least access to healthcare. It brings me also, and quite in line with this project, to talk a little bit about cultural and health mediation. And I would argue that you cannot have meaningful access to healthcare without being able to navigate it properly. Language is one key part of that, but there are many other parts of that, which of course many of you will be aware of. So what is cultural mediation? It's a culturally sensitive approach recognizing diversities in health issues, as well as the different cultural, religious, traditional beliefs. It can act as a bridge between the people of different socio-cultural backgrounds and health professionals. And it's been demonstrated to increase not only access and quality of healthcare, but also to prevent errors, increase compliance, improve outcomes, and decrease costs. So it's really best practice. Why does it matter in COVID? Well, in COVID, as you know, and we have talked about this, and you would have read it in many parts of the media, there's of course biological vulnerabilities, such as, for example, people at older age have poorer outcomes, but there's environmental vulnerabilities. So I put here a couple of examples from Greece. As you can see, people in reception centers or in camps that actually where there's crowded accommodation are much more vulnerable to not only higher attack rates or higher transmission, but also to poorer outcomes. There's cultural linguistic limitations of being able to access healthcare meaningfully, socioeconomic disadvantages, not having the means to pay for some services that, and there is entitlement issues and access to care. Of course, I must point out that some member states, for example, in the EU, have moved forward and have actually waived requirements, and this is very well noted, and it's best practice too. In any case, these circumstances can lead to poorer outcomes and enhanced transmission risk, and that's not in our interest. I wanted to put this little diagram just for your consideration. So starting from the left in the purple, COVID itself does, of course, have health effects. We all know that, both direct, yeah, you can die from it, you can get very sick, but also indirect, which is, for example, via mental health effects and other effects. But then there are other effects through, for example, social distancing measures, through home isolation, through restrictions on non-essential sectors, on transport, and on closure of educational facilities. And without going in detail with through all of this very interesting diagram, which was published in the British Medical Journal, and I can circulate my slides later on, we have to realize how the multiplicity of factors interact to make matters worse, to make health outcomes worse, especially on those people that are on the most vulnerable. And some of the migrants I noted are amongst those people. Access to healthcare is, of course, from a human rights perspective, and we talked about the flagship policy of universal population coverage of healthcare from WHO, the flagship policy. We talked about that, and so that's one aspect to look at it. But I would argue that in a bit more hard-nosed global health security focus, which we may want to adopt, for example, when we talk about COVID, it's in our self-interest to have a good access and meaningful access to healthcare, because you're having less transmission and you're having better outcomes in the COVID. My last slide is just to summarize the key points. So we talked about the term migrants, and that encompasses a very diverse group in terms of health and access. And of course, you can see that not all of the factors that I said apply equally, but to some even more. There are biological, environmental, socioeconomic, and legal risk factors for poor health. Universal access to healthcare is both a human right and a flagship policy of WHO, but there are differences in inclusion of healthcare, the basket of services, and in the additional payments you have to come up with. Migrants communities can be affected, and we've seen this, I mean, there's ample examples, by COVID directly or indirectly in many different ways, also by loss of income, loss of right to remain, dependency on informal actors, which can be a dangerous thing. And good access to testing and care is ethical and good practice, and it's also in the self-interest of member states. So I shall end on this, and just to flag up, we've got a continuously updated migration health evidence portal for COVID-19. And once again, I shall thank you very, very much for your attention. Thank you.
Thank you so much, Dominik. This was really super interesting. Also, what surprised me is when you said we know surprisingly little, and this also resonates with previous presentations when Nuria also said it's so important to work with and not just work for. And I think this will also be one of the aspects that Irena will mention and share about what it means to have an intercultural approach to providing services, and how regions can provide services with an intercultural approach. Thank you so much. And the presentation is available in the handouts of the webinar. Don't forget to ask your questions in the question session. Thank you, Dominik. Irena, the floor is yours.
Thank you, Joanna. Oriol already introduced the main lines of the intercultural integration approach. And I will just say a few words about it more, because the intercultural integration approach is now a Council of Europe standard since 2015, endorsed by all Council of Europe 47 member states. The intercultural program of the Council of Europe, which now supports the Intercultural Regions Network as well, offers innovative and proven methodologies to translate the principles of intercultural integration into policy. Intercultural integration is an approach that targets the whole society, not just migrants, and is asset-based as opposed to deficit-based. In the past, quite often integration policies and practice have been based on the assumptions that migrants and refugees lack a lot of things. They lack language competence, or they lack skills, they lack work history or diplomas, and all the efforts have been concentrated on filling up these gaps. At the same time, there had been very little attention on the assets, except perhaps for lip service, little attention to the assets that migrants and refugees actually bring that could be the basis of their productive contribution to society. The intercultural integration approach focuses primarily on these assets, building on migrant strengths, and ensuring, for instance, facilitating language recognition or connecting job seekers with employers, facilitating entrepreneurship, and a lot more. As Oriol said, the intercultural integration approach takes the cultural dimension of integration seriously, and I'm really happy that during the poll, our participants identified the cultural sensitivity of services as the big missing part of service provision, because that's really the key point of the intercultural integration approach, is that not only the material conditions or formal rights matter in terms of accessing and effectively benefiting from services, but what matters is also the perceptions, the feelings of cultural closeness, distance, and rejection, civilizational fears even, and these are often instigated by political narrative. The overall tone and feel of public narratives and discourses, and even sometimes myths or conspiracy theories, the collective identity, all of these elements are extremely important, not just for building cohesive and stable societies, but also for individuals' access to rights, including access to services. And this is because these all mental and imaginary elements, they all help support or impede the sense of belonging and social trust. And maybe one argument to support this is to say that in societies where minorities are almost mostly economically integrated, where the economies are strong, they can still feel rejected and discriminated against, which undermines the cohesion and democratic stability of societies in the long run. The principles of intercultural integration are embracing diversity as a resource and ensuring effective equality by fostering mixing and positive interaction in the public space. Now, how do these principles apply for service provision? First of all, very importantly, by reducing the perceived cultural distance. Recent research has demonstrated that higher perceived cultural distance reduces interaction comfort and the quality of services and customer satisfaction from the personal point of view. Now, how does the intercultural approach help reduce cultural distance? First, by the diversification of staff, of service staff. By the way, which increases cultural satisfaction. By the way, a study by the Migration Policy Group on the intercultural cities using the Intercultural Cities Index proved that in cities that have adopted the intercultural approach, there is a higher level of satisfaction with services. So we have actually hard data to demonstrate that interculturalism matters in service provision. And diverse staff, of course, is much better capable of understanding customers' needs and to respond to these needs in culturally sensitive ways. It also reduces barriers to access, and now during the COVID times, it has emerged very clearly that some of the populations, especially those living in marginalized neighborhoods and newcomer populations, really had strong barriers to access the health services. The second way of reducing cultural distance in services is by bringing intercultural competence. Dominik spoke about this already. And this does not only help with accommodating customers' diversity, but also to unlock the diversity advantage. And diversity advantage is probably the key concept for the intercultural integration approach. This is the business case for interculturalism, because there has been sufficient evidence to prove that companies and service organizations are more innovative, more creative, more resilient, and even more profitable when it comes to for-profit organizations with diverse staff, but only when managed in a culturally competent way in order to manage conflicts in a productive rather than destructive way and to encourage the voicing of different perspectives. It's the listening to different perspectives of employees based on their different backgrounds is that enriches the companies and makes them stronger as well as service providers. Thirdly, third way of reducing cultural distance is by customer participation. And it's been established for a long time that customer participation is very positive for public services in general, but it's even more important for public services in diverse communities, because participation reduces the feeling that something is out of our reach, that we're not in control, and that it doesn't correspond to our needs. When service users are treated as citizens, that's when they become actively engaged in also improving the services, but also using them in the best possible way. Dominik also spoke about universal provision. This is one really important aspect for interculturalism. We have been arguing at the Council of Europe that there should be universal accessibility of services for undocumented residents, including. And many of the intercultural cities have already adopted the principle of urban citizenship, which means at the local level, we provide the services for everybody. All the residents are entitled to health, primary education or secondary education, and shelter, etc. Really the basic services, but some go much further, in fact. Finally, no segregation of service provision. And this is something that it's maybe not so obvious to understand, but beyond the fact that the services are not equally available physically and in quality in different neighborhoods, especially in the more, let's say, socially marginalized neighborhoods, which of course is detrimental to the populations in those neighborhoods. But segregated service provision sometimes is done really on the basis of goodwill. Some authorities and governments even may think that if you provide specific services for migrants and newcomers, this will give them a better service provision. But in fact, it sends a rather unhelpful signal to the entire population, a signal of difference, of division, that not everybody is treated the same, and also does not allow for contact and positive contact between newcomers and migrants. In a way, it's a segregation, and segregation is really no good. No good for either personal rights or for cohesive societies. It can reinforce stereotypes, segregated service provision, even if it's done in the best interest of newcomers because they have specific needs. So we have been arguing that although you should treat people regarding with their needs very differently, the provision should be still unified and universal. There are many other things, again, mediation, but Dominik spoke about it, so I will close here and will be very happy to answer any of your questions.
Thank you so much, Irena. You speak really about this virtuous circle between participation, then satisfaction of regarding the service. I think we can add also that this also improves the sense of purpose of the service provider. That you spoke about respect also between the public service and the people in the public service and the users. And it's this whole thing that participation is complicated. It costs energy and thinking and time and money, but it leads really to better results for all people involved, not just for the targets or users, but really also for those providing the services. There's mutual respect, and the intercultural approach actually allows to kind of institutionalize a system of listening to users. I suppose it's less we know what you need and this is what you get. But we take the risk of listening and let's figure out what we make together.
That's indeed perfect. Active listening, but also genuine readiness to accept and implement what you've heard, not in a tokenistic way.
Yes, accept as a system, accept to be challenged. And so that is really those very big challenges of social innovation, of innovation in the public sector and so on. There's a huge potential, but it is of course also risky in the sense that a challenge is something big. Now we're going to do a quick poll. A second poll is actually about the way your region is implementing and delivering services with an intercultural approach. So you can answer now. Do you see the question? I don't see so many answers for the moment. So you can think about how in your region public services are designed and delivered with an intercultural approach. Maybe it's in the consultation process. There's two separate questions between consultation and co-design, because maybe co-design is a step further in the participation. And there's the whole question which was mentioned by Irena about having a workforce in the public services that is similar in diversity as the public served, and that will also increase the intercultural competence of a workforce in the public service. And regarding the fact of considering residents' background when providing services, this refers also, for instance, to funeral services, meals at school, maybe sports facilities, this kind of things, where the service is provided in an inclusive way, which will allow all residents to take advantage of the service and not exclude by design certain people. And again, this is not to test you, it's more to get a little bit of picture of what the situation is in regions, I cannot see who said what, so don't worry about about being tested or something. It's really more to have some exchange with you. Okay, a few seconds more and then we're going to close the poll. Okay, share results. Interesting. So many of you say they work on the policy co-design. That's the majority. And then there's maybe a little bit less in the recruitment plan and then the provision of services with interculturality in mind. Okay, thank you very much. Peter, I'm going to give you the floor. I believe we have a few questions. So I will let you ask them to our speakers. The speakers, if you want, you can all put your cameras on so we see you again and we're all together again.
Good. Indeed, we have a number of interesting questions from the participants, which I would like to ask to our panelists. I would actually like to start with Oriol. Oriol, are you still there? Can you hear me?
Yes.
Yes, excellent.
Yeah, of course.
Very good. So we have a question about the Intercultural Regions Network. The question is, how many regions are now part of the network? The presentation seemed to have listed 10 regions. Which are these, and is the network perhaps also open to other regions?
Yes, we are still 10 regions. Yeah. We haven't increased the number yet, and we are in the initial steps. So we are not really looking forward to grow faster. We prefer to grow with step by step. Okay,
and which regions are those? The 10?
Yeah, I remember some of them. There are 2 from Sweden, 1 from Italy.
Okay. Yeah.
Another from and 4 from Spain.
Okay.
And I'm forgetting someone, which is very compromising to me now. That from Spain we are Navarra, Valencia, Catalonia, and Murcia.
Yeah. I'm sure you'll be forgiven, but thank you.
From Sweden, Västra Götaland, and
okay. Yeah. No, but it's a very interesting model, and of course we understand, you have to start small and hopefully, then build up on the success in the future. Thank you for that.
I can add just Emilia-Romagna. I think this is the only one you missed.
Emilia-Romagna. I said Emilia-Romagna.
I said that's right.
Yeah. The principles of the network are very clear on the approach of which kind of policies do we want. So network among different regions with different approaches, there are a lot in Europe. We are not interested in build another network more. We want to be clear. So those who want to be on the network has to adopt this approach very clearly, because we think that we need to build an alternative to some of the discourse that today we can hear in Europe, and it should be a clear alternative.
Okay, thank you very much, Oriol. I'd like to move to Nuria for the next questions. There was a question related to the European Advisory Board, and does this board deal specifically with migration issues? And Nuria, I would also like to ask a second question that came from another participant who's wondering about, the mandatory work permits that exist in EU member states, even though, third country nationals have European degrees. So how do you look at that? Nuria.
Yeah, I'll answer first on the Migrant Advisory Board, the first question. So this was a pilot action that we tried for a duration of a bit less than 2 years, and they are migrants and refugees with expertise on integration, migration, asylum, and we work. The mandate was to look at integration, But in fact, they decided themselves to focus more broadly on all migration and asylum issues. And they did, for example, something very interesting. They did a survey within migrant communities that is called Ask the People. And there they asked migrants in their communities what were the main issues, the main problems, and then came issues on many topics, ranging from higher education, being de-skilled, like if your qualifications are not recognized, to issues of like permits, of documents, to issues of children, so very broad. So they wanted themselves to be active on all sorts of issues. After this initiative finished, because it was foreseen just for this period, we learned that it's a very good initiative, that it's really important to continue. And this echoes a little bit what Irena said in the beginning. When you listen to the users, it's also, in fact, a parallel I can make as a policymaker is a matter of we say better regulation, or better, even if it's not, there are not laws or regulations, but it's a matter of making better policies. You need the information to inform your policies. And this information includes many aspects, qualitative, quantitative, and also actually experiences of people and their needs, listening to them as part of collecting the evidence so that we know what are the issues, so we can design the policies better. So it's a matter of better policy making. The second one, though, I haven't understood well enough about if it was what kind of permit it was. So if you could explain a little bit more the question, or come later, because I didn't quite catch it.
I will repeat for you the second question. So this question is from a participant who is asking about what do you think about mandatory work permits in most European countries, though many third country nationals actually have European degrees? So perhaps it links to, how we can facilitate also, access to the labor market for third country nationals who do have European degrees. And I understand also that, with the revision of the Students and Researchers Directive, the Commission also sought to, provide a bit more flexibility and a bit more options here. Is that correct, Nuria?
Yes, thank you for for almost half answering the question. Grazie, thanks a lot. Yes, so it's I was a little bit confused, but indeed, because there are different strands. So one is the so-called legal migration strand. So there are the different legal instruments to have a residence permit in the EU. Then there is the facilitation for students and researchers, and the fact that this directive includes that when you are so you're a third country national, you came to a new country for the purpose of study or research, or there are also other purposes in the directive. And then there is a period when you finish your period of studying or researching, you have a 9-month period where you can stay in the country to look for work and apply from the country. So you don't have to go back and forth. So to facilitate that, even if you are a third country national, you have a degree from the EU, you would like to stay in the EU, and we give you, you have extra time to find it and remain. So this is the reason I was also confused, is because in my daily work, I'm not working exactly on this. It's other colleagues in my team who work on this, but I work more on the integration side, where there we are a little bit more facing the obstacle of people who have qualifications from a third country that are not recognized or valued or enough appreciated in the EU, and then they are overqualified for their jobs or underemployed, and they lose their skills. So which is why I got a little bit confused with the question, but thanks a lot for asking it.
Yeah, no, and I think indeed, Nuria, that's also an important element you mentioned about unfortunately, many people who come with skills that we actually need, but since it's very difficult to recognize diplomas and degrees, it often leads to challenges. But perhaps something that COVID has shown is that during the crisis, in some countries, actually, they openly called upon, any migrants with a medical background to come forward, even though perhaps, their qualifications weren't, formally recognized. So it's an interesting example. Now, I want to move now to Dominik, and there are 2 questions that I would like to ask you that relate to, how, first of all, is gender, included in the approach that you describe, but also not only gender. What about disability? There is indeed the UN Convention on the Rights of All People with Disabilities. So how do you see this intersection between gender, migrant status, and disability? Dominik, that's for you.
Thank you, Hertroy. This was 2 questions. I was waiting for the second question, but this is
no, one was on gender and one on disability. But I think you can, take it as one question.
There is a fundamental. So one of the things I did not mention very much, but actually mentioned only in passing, and it was on one of the slides, is the principle of equity. So equity means that basically you need to go the extra mile for people that need it, basically the extra mile, in order to bring them to the same level of access. It's quite well recognized that there can be additional vulnerabilities and there can be additional needs in particular groups. It's very evident for disability. It's also clear in some circumstances for gender, and health services, of course, need to be not only culturally appropriate, but also appropriate in terms of meeting those additional needs in the sense of equity. It's also clear, just as a personal word, and I think some writing has been done on this, that the COVID crisis, interestingly, has led to an increase of inequalities and inequities, arguably, especially in the gender domain. And that's been clear because women, whilst biologically it seems that the mortality was higher amongst males, the indirect measures that led to, for example, multiplying the needs for tasks to be achieved, for example, on the homeschooling, for example, with difficult circumstances, caring for the household, has increased the inequality in the gender sense. And I think it's important to be very mindful of that, to be conscious of that. And of course, it goes without saying that equitable and appropriate and accessible health services need to be just that, equitable. So, and these are domains of equity.
Yes, thank you very much, Dominik, for your views on this. And I would actually like to ask Irena the same question, because it was addressed to all panelists. So I wonder also, when you explain about the intercultural approach, how do you see there, the intersection with, for example, gender and disability? Irena?
Sorry. Yes, yeah. Intersectionality is a parameter. It's one of the dimensions of the intercultural approach. For us, the main way to deal with this is to increase the knowledge of all those practitioners, policymakers, service professionals who deal with specific target groups, because often services are organized by target group, about the, let's say, discrimination or the issues in lives of people with other characteristics. So let's say to increase the competence of those who deal with migration, to know about difficulties and problems that are faced by the Roma community, for instance, because they always also migrate across borders, or by LGBTI migrants, etc. So first, the first way of dealing with intersectionality is really sharing the knowledge and building the capacity across those silos that might exist in the public administration and in the service professionals. And the second way is to actually bring together those services and those administrative departments that used to be separated under one roof. I mean, while specialization might still exist, and it takes years until you actually learn all the intricacies and challenges surrounding the lives and problematics of different categories of people and different parts of their identity, it's still very important that these professionals talk to each other, that they conceive common strategies, and that when the strategies are done at the local or regional level, they be holistic and not group targeting. And finally, what we promote is the building of consultative bodies or any kind of participatory frameworks. They really enable the participation of people with very different backgrounds. So increase the diversity as much as possible. And again, not in a tokenistic way, not to tick boxes, you know, you understand me, but in a genuine way, by really representing the diversity of the society. And then, yeah, these are the three key elements.
Okay, thank you very much, Irena. I see the questions keep on coming in, and at the same time, I also see it's already 12:05. So we will answer, you know, the remaining questions now, but unfortunately, then I believe our time will be up soon. So I have, first of all, a few more questions on the network. So I think these are addressed to Oriol. So the first question is, I would like to know what are the conditions to be able to join the intercultural regions? And secondly, are regions of the EU only eligible to join the network, or also other regions? This question comes from somebody who's working in Turkey, and there as well, you know, questions of interculturality are extremely high on the agenda. So Oriol, could you clarify this for us briefly?
Yeah. We are open more. We are open to include more regions, not only the EU regions. In fact, we are supported, and I want to thank that point for the Council of Europe and for the Assembly of European Regions, and both organizations are bigger than the European Union. And the only condition is to be committed with the objectives and the principles. So if these regions wants to work hard against the racism and xenophobia and to adopt the intercultural point of view, are welcome. But the only condition is to be committed with the objectives and principles. I want to underline that because there are a lot of networks, and these networks wants to be very clear on that point.
Thank you, Oriol, for clarifying that.
Just to correct my fault in the previous answer, there are 3 regions from Sweden, 1 from Norway,
okay.
1 from Romania, 1 from Italy, and 4 from Spain.
Okay, with this we have it right. Thank you very much, Oriol. And then there is a last question, which I think you know, would be addressed both to Irena and Dominik. This question comes from Elizabeth, who is managing the Equal City project. It's a project implemented by IOM, looking at building capacity of city services to prevent and address sexual and gender-based violence in migrant communities. Now, they noticed that frontline health workers often, you know, recognize, you know, the lack of intercultural competences to assist migrants specifically. And many of them also identified the lack of knowledge of migrant-specific health issues, such as, you know, forms of SGBV. Now, this project will develop specific tools for these city services, focusing on that. And they ask, are there any recommendations you would give to us? So any recommendations on how basically city services, you know, can better tackle or prevent sexual and gender-based violence in migrant communities? Any recommendations you would give, Irena?
Well, first of all, I think this is really good that this project is happening. I think it's really very, very needed. Now, recommendations, maybe something in relation to what we are recommending as intercultural cities in relation to mediation. Because we have observed in the early days of mediation, the provision was done by specifically trained mediators, so people whose job was it to be linguistic or cultural mediators. And of course, this has limitations in numbers, in funding, you know, it costs money, and they may not necessarily be easy to call upon whenever you need them urgently. So the next development in the doctrine was to actually train your own staff, and not just train them, but use them as mediators, especially linguistically, but that means map their competences in terms of language and also provide at least basic mediation competence. So I would say perhaps apply the same principle when building the capacity of service staff to deal with violence or specific health issues is that you never know who will be meeting whom and how they can be able to find this person. It may be a completely different, it could be somebody dealing with housing or education, that they actually have the possibility to understand that violence is happening. It's not necessary that people will come and tell you, you have to be able to detect it. So raise the awareness and this at least basic capacity of all staff at all levels to be able to attune and feel when there is something, so that they can refer the victims to the right professionals. I think it's not enough just to build a very deep and very specific capacity in some people. You have to go broad.
Yeah, you have to make sure that everybody can perhaps detect some of the signals and know where to refer to the right services. Thank you, Irena. Dominik, anything to add to that?
Yes, thank you very much for actually preparing the floor already for me to cut it very short, but rather to pad it out a little bit. For me, this is among so all the people that are interacting. So this is healthcare workers primarily, but also the victims themselves, of course, the relations, of course, and of course other services such as police and social services needs to not only to be made aware. This is one thing. A lot of projects center on awareness, but also to be empowered, which is different. So that is having a toolkit of what actually needs to be done and can be done. One part of that toolkit is things like algorithms, clear referral pathways, clearing and knowing a little bit intricately. I talk now as somebody who's also a doctor. It's very difficult when you are faced with a person like that to know what is the right thing to do, not over because things aren't very clear cut sometimes. Sometimes some agencies go in and out of business, and you might not have the newest referral pathways, etc., etc. So these kind of things, empowerment is my key point in there, are very, very crucial in order to improve that, and this comes in addition to the awareness. That's what I wanted to add.
Thank you, Dominik. Indeed, empowerment is very important here. And with this, I would like to thank all the panelists for answering the many questions of the participants. To the participants, if you feel your question was not addressed, of course, feel free to follow up per email. Thank you very much, and over to you, Johanna.
Thank you so much, and thank you for this very interesting discussion. You saw that normally I would appear on the screen to cut things short, but it was really interesting, so I thought that I'd rather disappear for a while. Thank you so much to all the panelists for these very, very rich inputs. To all attendees, there will be a survey launched right after the webinar. It will appear on your screen. And this will also give you the opportunity to give inputs for the next webinar, which we would like to organize in September. So if you want to help us and if you want to participate in this mutual learning process, please give us your inputs. It will be really super quick. Thank you very much to all. Bye-bye.
Thank you. Bye, everyone. Bye.
Thank you very much.
Bye, everyone. Thank you so much for listening. Bye-bye. Bye.
Bye. Bye-bye.